Hi, thanks for joining me today. I want to talk to you about recommendations on returning to exercise, sports, and activities after you've had a COVID-19 illness. There was an article that came out in Journal of American Medical Association from the cardiology section. This was October 26th of 2020. Um, I didn't share it then, but now as time goes on, I'm having more patients who tell me either themselves or their spouses or their adult children or teenage children are they've had COVID and they want to get back into their exercise routine, into their sport, and some other patients just want to get back to cleaning their entire house. Um, so I decided I should go through with this study. Just know that things are changing. Why won't this advance? There we go. Information is going to change, just like it did in the very beginning of COVID. We didn't know anything about the disease or the virus. And so initially, we had suggestions and then those evolved over time as we learn more about it. And that's just how science evolves. If you think of how we treat diabetes, how we treat cancer, how we treat osteoporosis, how surgeries are performed, all those evolve with time. That is the nature of medicine. We learn more, technology changes, we get smarter, research is at your fingertips now. So things change quickly. So you can expect that this information is going to change as well. And when the next study comes out or the next publication comes out, I will jump on here and give you the update. So just know as this pandemic lengthens, the research is going to continue to progress. But what we know now is that after our symptoms of COVID are over, there can still be lingering effects. You can have organ damage, including your heart. You can have issues with blood clotting. People have severe fatigue for months on end. Some people don't. Some people lose taste and smell for a few weeks and it's over. Some lose it for months. So everybody has different outcomes. So we're going to talk about the big concerns and give you some guidelines on what you need to be concerned about, when you should go to the doctor, or when it's safe to continue on. The biggest concern about the cardiac effects is a condition called myocarditis, and that's where you have inflammation around the heart. And this study is very sensible, so we're going to go through it now. The biggest take-home message, no matter which category you fall into or what your age is that when you start to return to sport or exercise or activity, you need to do this very slow and gradually. And what you need to pay attention to is your tolerance to the exercise, sport, or activity, if you have any chest pain or if you have any arrhythmias. Now, arrhythmias is a change in your heart rate. So say you're just sitting here having a conversation and you don't even notice your heart rate. Most of us don't under normal conditions. But then all of a sudden you feel a few flutters where it takes off quickly or it feels like it's slow. Those are arrhythmias. So initially, again, you're gonna lose some of your tolerance to activities and exercise, but this should improve gradually with time. So every week you should be able to do a little bit more and a little bit more, and you should not notice any chest pain or arrhythmias. And if you notice any of those things, then please contact your primary care physician. He may want to do some lab work, looking at cardiac enzymes. He may want to do an EKG, or he might want to send you to a cardiologist. It just depends on your particular situation. So if you tested positive for COVID and you have symptoms that you either have no symptoms or you have minimal symptoms, then you need to rest and isolate for 10 days and then a slow and gradual return to your sport, exercise, or activity. So, people think if they don't have any symptoms, it's okay as long as they're not around other people. But even if you are not around people, you should wait 10 days before you go out on a run, before you go in your garage and exercise. Just limit those for 10 days. If you have a positive COVID symptom, positive COVID test and mild symptoms, such as, a sore throat or runny nose, then you want to wait 10 days after full resolution. And then after every one of your symptoms are gone, then you can return to your exercise, sport, or activity, but again, very slowly and gradually, and monitor those symptoms that we talked about. If you have moderate symptoms and a positive test, say you were homesick, but you were not in the hospital, that's what we're going to consider moderate. Then you need to rest and isolate 10 days after a positive test. And then you want to wait an additional 10 days after symptom resolution and return to sport with a very, very slow progression with a health professional. So that could be with a physical therapist. That could be with an athletic trainer. That could be with someone who has an actual degree in the health profession and they know what symptoms to monitor while you're exercising. People at this level do need an initial screening from their doctor before you meet with your healthcare professional to have that slow progression. So if you come to me and you're wanting to get back into exercise and you had moderate symptoms, but you are not hospitalized, then I'm going to send you to your doctor for a screening before we get started. We can do our evaluation, but I would want you to see your physician before we start exercising. Now, anything over that, then you need to see your physician before you come to physical therapy to get started on your exercise or your sport. If you are over 65 and you have a positive COVID test, then you definitely need an initial screening with your primary care physician prior to seeing a physical therapist or prior to resuming exercise and sport. And that's even if you did not have any symptoms. If you are under the age of 15, even with minimal symptoms, then you need to have a cardiac screening before you return to exercise or sport. If all is well, you can return to sport 14 days following your symptom resolution. So I just want to reiterate before we close up that no matter which category you fall into, your return to sport, exercise, or activity should be very gradual, and you need to pay close attention to your tolerance to exercise, sport, or activity. You need to be aware of any chest pain and any arrhythmias. Initially, you're going to feel some loss of your tolerance, but you should see a gradual improvement week to week. If not, please see your primary care physician. I hope this is helpful and give you some type of guidance. And anytime you're ever unsure, then I would highly recommend you reach out to your primary care provider and just make sure everything's safe before you get started. And if you're uneasy or you had moderate symptoms or above, then you should start your exercise program with a healthcare professional. Thank you so much. And I will attach this article in the comments for your reference if you'd like to read the whole thing. Have a great day.